Reusable Learning Object on Fluid Balance for the First Year Student Nurse by Chinenye Udochukwu, Third Year Nursing Student. Aim: by the end of this presentation, the fluid balance and the fluid balance chart would be explained to the first year nursing student. Objectives: by the end of this presentation, the student nurse will demonstrate a better understanding of the fluid balance chart, recommended daily fluid intake, chart demonstrations, and scenario question and answers. What is fluid balance? Fluid balance refers to the maintenance of fluid in the body, which is regulated by the relationship between the volume of fluids gained, hormonal control, and fluids lost in the body. Fluid balance chart. The fluid balance chart is used to measure the patient's fluid input and output over a 24-hour period. According to the National Confidential Inquiry into Patient Outcome and Death, 2002, the fluid balance chart should be accorded the same attention as the drug chart, as accurate monitoring, early recognition, and appropriate treatment of fluid balance are essential in surgical patients. The recommended daily fluid intake and output for a healthy adult. According to Smith and Field, 2008, the average healthy adult should have between 2 liters and 2.5 liters of fluid from food and drinks per day. Daily fluid loss from urine, feces, and insensible loss also amounts to about 2 liters to 2.5 liters per day. Urine output should be calculated as 0.5 to 1 ml per kilogram per hour and 2.25 ml to 1 ml per kilogram per hour for elderly adults patients. The amount of fluid intake should be equal to the output. Overhydration is caused by too much fluid being retained in the body, and dehydration is also caused by too much fluid being lost from the body. This is a diagram that shows different measurements of different equipment used for patients in the UHNM. This is specific to the trust, and different trusts have different measurements for their equipment that is used. So, for instance, a cup of tea is 150 ml, and the beaker is 200 ml. This is general across the trust. As I said earlier, this is for UHNM Trust, formerly called University Hospital of North Staffordshire, but the documentation still stands and is still being in use now. This is a fluid balance chart. It is a confidential document and should be handled with utmost care. The patient's name and details are on it. The ward number, hospital medical number, the sex of the patient, the date of birth are all on this document. So therefore, it is a legal document. The patient's allergies should be recorded accurately. If there's any specific instruction or reason for the fluid balance to be that reason why the fluid balance is done, it should be recorded. If the patient has had any bloods taken, the results should be recorded accurately. The name of every prescriber, all the prescribers should be written, and the goal for the fluid management should also be written. This document should be signed and dated at every use. Then this is the front bit. If the back also shows some specific instructions, like for instance on assessments and signs for use. Okay, let's go into that's it for this. This is the fluid balance chart where you write the input and output balance. That is to say what the patient has had orally, intravenously, intramuscular, nasogastric. All inputs are recorded on the right side of the document, and then all the outputs, which include urine, vomit, maybe stool, drains, are all on the left side. It's a 24-hour chart. If, for instance, the patient has had, let's say, a cup of tea at 8 o'clock, you document that, and then maybe he is having IV fluids, for instance, normal saline. You have to check how much is it's prescribed for hourly, let's say 200 mils per hour. You input it and then you calculate how much he has had, and you write it where it says running total. So you add to this running total as the day goes on, and if anything happens or any changes happens along the way, or you're concerned about anything, you need to take action immediately. You do not wait to the end of the day or to the end of the shift to take action regarding this document if you're concerned for any reason. At the end of the shift also, you need to check the input and the output to check if there's any discrepancies. And how to do this is you minus the output from the input, and if it is less than what it should be, you need to report this to your mentor. You also have to find out what the insensible loss is. In this case, the estimated insensible loss is 600 mils, and you need to write that down. This chart has to be reviewed regularly as you go on. Thank you. Question. From the above demonstration, this is a patient scenario. If a patient has had 2 cups of tea at 1 p.m., a glass of water at 3 p.m., 5 mils of IV, normal saline between 6 and 7, how much fluid has the patient had? So from here we can see that the tea is 300 mils, which is 2 cups, 150, 150, and a glass of water, 150, 500 mils of saline. So that makes 950 mils. In conclusion, in this RLO, the fluid balance chart, as well as some questions and answers have been discussed. If you need more information, you can refer to the reference materials below. Thank you for listening. Any questions? This is your reference list. If you have any more questions or you want to read up and refresh your memory or get a little bit more knowledge, you can read from this reference list. Thank you.